Okay, so what I'm going to talk about is more about, obviously Dave's talking about the journey into the course, and I'm giving a bit of an outline of just what it's like to be taught at Queen's, and what do we teach and how do we teach on the course itself. So first of all, what informs our curriculum? So the curriculum is pretty comprehensive, and if you might want to ask Thomas and either of the trainees about how comprehensive it is, because it is very comprehensive. There's lots of teaching, and that's a good thing. I think trainees are always interested in more teaching, more skills, more development. That's part of why they want to be on the clinical psychology course, because they want to get skills and become the best practitioners they can be. So what informs the development of what's on the course? So the first thing is, and Dave's alluded to this already. We want to train reflective science practitioners. So we want people who are reflective, insightful into their own processes, their own biases, to have self-compassion and to be able to think about their own background and how it conveys and displays and emerges in sessions with clients. So we want that reflective capacity, but we also want to foster a scientist practitioner model too, so that like research and clinical practice and evidence-based practice are key features of the training course as well. And that's what we need to meet the workforce needs here locally in Northern Ireland. So let's get into more specifics. That's a global goal, really. But what do we do in terms of specifics? Well, obviously, we're accredited by HCPC. That's what you have to be accredited to be an accredited clinical psychology training course in order for your qualification to mean you can practice as a clinical psychologist, as well as BPS guidance on accreditation. And the BPS guidelines have just been revamped and renewed, and there's a big focus on equality, diversity, and inclusion. And other elements that are a big focus as well. So again, there are these continually evolving standards that we have to keep on top of, because that is where we need to go as a profession going forward. But we also get feedback from services as well. So local services, as I'm sure a lot of you will know, Northern Ireland has had obviously a history, a legacy of societal conflict, which has led to a lot of positive developments like the regional trauma network here, as well as obviously a legacy of mental health need. We've 25% more mental health needs here in Northern Ireland relative to the rest of the UK. And we have a high levels of post-traumatic stress and complex trauma reactions. So services will obviously want us to cater to that population and the needs. So we have a lot of trauma-related therapy teaching throughout the 3 years here. Obviously, that's one obvious matter, but there's lots of other more subtle elements of the course that are influenced by the fact that local services will advise us as to what is needed in terms of course delivery. We also have internal quality assurance methods as well. So every session of teaching is open to evaluation, as are the modules. So trainees often give feedback at various forums as to what they think would be helpful and what they think is good, working well, working not so well, needs improved, or new things that needed added to the course. So we have lots of different content elements informed by different areas and different specifications and different groups. There are a number of stakeholders and specific people who will give reviews and monitor and govern our teaching. So the big one is the curriculum panel, which I chair, and has a number of representatives from the experts by experience, also trainees, DCPNI, Division of Clinical Psychology reps, special interest groups. So basically we meet up with lots of people who represent different specialisms, different viewpoints, and we have discussions and agree courses of action in terms of where the curriculum needs to go. And we also have direct panels, as you will hear from Sharon later on, from experts by experience, how they give their views on various elements of the course, as well as just the wider school. Wider school will guide us in terms of where we need to go, and also external examiners who quality assure our course as a whole. So what are the actual academic modules? So if you come on the training course, you will have 3 academic modules. So you'll do 1 per year. So Psychology 9053, Clinical Psychology 1 is the first year module, and so forth. But within each of those years, there is different types of summative assessment. So you have to do some assessment to pass each of those modules. So in first year, there's 2 assessments. There's a clinical essay, which is only 25% of the mark. The clinical essay is a new thing we've introduced this year. It really gives people an opportunity to get some feedback on their writing and get a sense of what the level's like for the doctorate course. And then you do a clinical report, which is basically a case study of a client you've worked with on your first placement, and that's 75% of the mark. In year 2, there's only one piece of coursework, and that's a second clinical report, which is 100%. And then third year, the trainees are flexing different muscles, where they're actually going to, instead of write a report, they're going to present a report. Because obviously in the modern health service, team formulation, engagement with multidisciplinary teams and organizations is very important. So presentation skills and conveying client information and reflection is important as well. Now that's 3 modules, as I've said, but within those modules, there are streams that cut through and cut across all 3 year groups. So there's 4 streams. The first stream is clinical presentations, and what that refers to is typically what you think of maybe historically as diagnoses or presenting difficulties. So things like depression, anxiety, obsessions and compulsions, post-traumatic stress. And the type of clinical presentations will vary through the year. So first year is predominantly adult mental health. Second year would be child, intellectual disability and neuro. And then third year would be more specialist populations and specialist presentations, such as complex trauma, could be forensic ID populations, things like that. And therefore the clinical presentations will reflect each of those year groups. So first year, anxiety, depression. Second year, autistic spectrum disorders, different neuropsychological presentations. Year 3, maybe more specialist presentations of health, etc., etc. So again, the type of clinical presentations that we teach depend on the year. Same thing for assessment and formulation. So in first year, the assessments will be predominantly adult mental health assessments, CBT assessments. And then year 2, moving into child, ID, neuro, and then year 3, more specialist assessment and formulation. And that's the same for interventions as well. In year 1, the predominant intervention that's taught is CBT, followed closely by psychodynamic perspective. But you'll also learn third wave modalities such as CFT and ACT. But then second year focuses predominantly on systemic therapy and more interventions with those like child, intellectual disability, neuro populations. And then year 3 is very much specialist psychological therapies, and I'll talk about that later on. Our fourth stream is more about that reflective practitioner role. So it's more about your own personal and professional development. So we want people to think about their social graces. We want them to think about wider societal issues that are going on and how it impacts on our clinical practice. And we have 2 main ways of doing that. One is the personal awareness groups, which all our trainees do. It's almost like a reflective practice group where trainees get in small groups in each year group with a facilitator, and they'll reflect on how it is to be a trainee, what issues they're facing day to day in terms of their clinical work, the demands of the course. So that allows them to reflect on their own personal and professional development. And then the second one is a new thing we've introduced this year, which is full days on reflection and context in practice. And really what we're doing in those sessions is 3 things. One, developing problem-based scenarios, like real-life ethical scenarios and issues that may emerge in clinical practice, and trainees have to think about how they would handle those situations and reflect on that. The second is to present clients. So you present your clients in this session and get feedback from the facilitator and have a think about what the clinical work is, how it's going, et cetera, et cetera. So getting to get an experience of reflecting on casework. And then lastly, a seminar component, which focuses mainly on current topical issues to do with race, to do with gender, to do with societal issues that are going on that really are relevant to our clinical practice. And that's quite a sort of an open space. It'll be very flexible and will depend on what live issues are going on in modern day. So what does that look like in each of the years? Well, I've talked about some of this already, but you can get a flavor for it. So clinical presentations in first year, mainly anxiety, depression, post-traumatic stress, etc. Assessment and formulation, it might be generic risk assessment, adult mental health assessment, CBT formulation. The interventions are predominantly CBT and psychodynamic, with some dipping the toe into compassion-focused and then acceptance commitment-focused therapies, which will then be built upon in third year going forward. And then, as I said, the PPD development will be those PAG and reflection and context and practice type scenarios. Year 2, clinical presentations would mainly, as I said, be things like emotional behavioral presentations in child and adolescents, autism, whereas the assessment and formulation would be more about how to actually assess intellectual disability, how do I assess memory in, say, a brain injury placement. And the intervention methods, predominantly systemic therapy, a significant amount of teaching in that area, as well as specialist intervention modalities in different presentations. For example, positive behavior support in intellectual disability. PPD would be the same, PAGs and RCP sessions, as I mentioned already, but also additional sessions on culturally sensitive therapy, working with interpreters and other wee elements like that, that will hopefully make people more attuned to those types of issues and practices. Without repeating ourselves in year 3, this just gives you a bit of a flavour of all that stuff will be available obviously in year 3 too, but year 3 is mainly focused on specialist psychological therapies. That's what we've really badged this as. So you'll be getting high intensity, very complex psychological therapeutic modalities, which again is something that we pride ourselves here in Queen's. Not all courses will have much teaching in 3rd year, but we still do have quite a bit of teaching in 3rd year. So for example, Alwyn, who you hear from, is highly trained in schema-focused cognitive therapy. She'll be doing a number of sessions on that. We have Ross White, for example, is a specialist in acceptance and commitment therapy, so we'll get advanced teaching on that. Compassionate resilience, specialist interventions in psychodynamic, as well as advanced CBT, and specialist interventions in various populations like brain injury and clinical health. And we also have some places on EMDR as well, because as I said, Northern Ireland has a lot of complex trauma, so therefore we do believe in providing in some shape or form, if it's relevant and if the trainee wants to engage in EMDR training. So what about the teaching days themselves? So that's a picture of our building, the Avocaro building. Actually, I just noticed the other day when I was looking through these slides that that's actually from the 90s, that photograph. So just imagine this place, except it has maybe more updated cars and probably less questionable fashion, but no guarantee on the last one there. But anyway, it is that's the building that you'll get your teaching in, and there are regular teaching days. So the normal teaching day would have maybe 4 1.5-hour sessions. So basically, you're teaching from 9:30 to 5 p.m. There is a teaching block each year, but in 1st year, for example, you'll get taught 9 to 5:30 or 9:30 to 5 p.m. for 7 weeks, and that's obviously because you haven't gone on placement yet. You need to get front-ended in terms of getting a lot of teaching, so everyone is at a certain level before they go on their first placement. But then after that, there all year groups will have maybe a day a week of teaching that runs throughout the year from September to June. Teaching is generally led by experts in the field. We've got a very supportive, very involved, very enthusiastic practitioner group here in Northern Ireland. So again, it's not all core staff presenting, far from it. We have over 100 facilitators, would you believe, who are experts in the various areas, and they will teach you those specialist topics themselves, as opposed to generic teaching by, say, core staff like myself. But we would obviously teach in our specialisms. My area is complex trauma. I'll be teaching on post-traumatic stress, etc. So you will get the core staff teaching too. But we're also very fortunate that we've got lots of links with various international experts. So we had Martin Doherty, who's a professor in New Zealand. He's a graduate of Queen's here, Queen's Doctor in Clinical Psychology, and he's a well-renowned, one of the biggest names in dissociation and dissociative identity disorder. And he lectured here, was it like just a few weeks ago, came all the way from New Zealand, a very big supporter of the course here, and very loyal, and you'll get people like him coming over every now and then to teach the trainees. What do we aim to cover? This should give you just a very brief outline of some of the elements, really, that this is a typical maybe 3-day year 1 breakdown of teaching. So for example, on 3 days, you may be getting taught by me on post-traumatic stress in the morning time. In the afternoon, you might be getting taught a session on CBT. The next day, David might be giving you a more fluid session where you get to practice like therapy skills, less sort of didactic and more interactive. Then you might get me teaching on case notes, then the psychometric session. So you can see how there's a lot of variety and a lot of sessions really that will hopefully train you and skill you up to do your placements. So we do want to provide high quality expert teaching that will inform your clinical placements, so you're ready to go and do your placements and have those skills when you go on there. But also we do want to very much focus on making sure that you're able to assess, formulate and intervene with the relevant populations that you're working with. And also, we want these here materials to be your consultation materials after you qualify. I would still, from a number of years after I qualified, gone back to my teaching in DClinPsych and consulted it. And that's what it should be. It should be at that level that you can consult going forward in your career. But there's another thing as well that isn't really taken into account here, where is it that there's a lovely sort of academic atmosphere, Queens, in terms of your year group. You'll form strong bonds with your year group. And that will be a secure base. And that secure base is in the academic side. So you'll be coming in once a week. You'll meet up with your friends and your colleagues, and you'll get taught something hopefully interesting that will help you then go and become a better therapist on your placement. And that's the plan. So in summation then, just a review. So as you can see, we do have a substantive amount of expert-led tailored teaching and hopefully a lot of resources to help people become effective, reflective scientist practitioners. It spans across the 3 years. There's teaching blocks, and it should feed into the placements. That's the whole aim of how these things are organised. Teaching is delivered mainly by clinical psychologists who are experts in their field, as opposed to generic teaching, which is something that we're very proud of. And we really do hope to make the teaching very pragmatic and very much making that link between theory and practice so that we are reflective scientist practitioners going forward. And as you've seen, there's a multiple amount of assessment methods. So that goes from topical essays to case studies to case presentations that reflect hopefully the knowledge you've acquired and also the clinical work that you'll be doing. Okay, and that's finished then for that. So I'll stop sharing now.